Welcome to episode 3 of Apostolified Conversations. In this episode, Dr. Jonas will be answering Is It True questions about oral care, veneers, and most asked questions on our TikTok account. So we hope that you enjoy this conversation. Hello everyone, your Apostolified Smile Squad is back. Welcome to another episode of Apostolified Conversations. I'm Elaine Apostol and
This is Dr. Jonas, Apostol.
welcome to episode 3. So, episode 3 is all about Is it true? Is it true? So may mga questions tayo. Dr. Jonas of course will be answering those. But first off, let me take this time to say thank you to everyone who supported our first 2 episodes. Dami nating mga friends, family members, even supporters from YouTube na talagang nakasubaybay who really tuned in to our podcast. And the goal really is to educate and to spread information about dentistry through another through another avenue, which is Spotify. And ma-upload din naman yan sa mga other social media accounts. But thank you so much and I hope you will continue to support us in the next episodes to come. Okay, so yun na nga, sabi ko episode 3 is it true? And then may mga question which Dr. Jonas will answer. So ano bang questions? So these are the questions, general, main, trending questions sa internet that we found. Also, i-include tayo ng questions on TikTok. Specifically on TikTok that we included.
Okay.
So first, we will tap on general questions, mga common misconceptions sa oral health, etc. And then, of course, we will move forward with yung veneers or restorative and cosmetic dentistry. Okay, so before we start, disclaimer lang po, everything that we will be discussing, the answers that I will give or Dr. Jonas will say, it's merely based on our personal experiences, personal opinion, but we also hope to answer science-based. But, yun lang, simple disclaimer. Okay. So, let's start with the questions. Is it true? First up, is it true that charcoal toothpaste work in whitening the teeth?
With the active ingredient of charcoal, it can whiten the teeth, but it's limited to extrinsic, no? Hindi siya sa loob. And also, when we talk about like toothpaste like that, it's not as like for daily use. It's not recommended because of the abrasiveness. Medyo mas abrasive siya, so it can damage the enamel if used every single day. So, hindi siya 100% recommended. It can whiten. Yes, it can. But it's not as effective as whitening, chairside whitening in the
In-house
clinic,
dental whitening.
or mga strips, yung may mga products na peroxide base. It's actually far different. Like the effectiveness is not as close. So can it whiten? Yes, but hindi masyado.
Okay. Second, is it true that coffee and colored drinks or food can stain your teeth?
Yeah, of course. Definitely, it can stay. Pero extrinsic lang naman yun eh. It can be removed naman.
Through
Through whitening,
And
charcoal.
and regular
Brushing,
oral
yeah.
prophylaxis and brushing.
Yeah, you have to brush your teeth after drinking coffee if sobrang paranoid ka when it comes to staining, or you can um do mouthwash. Pero you can
Or use a straw.
exactly, but you can brush it off, no problem.
Mhm.
Yeah.
And also, Doc Jonas, we have a machine, an airflow machine, that can help easily remove the stain.
Yeah.
It's called airflow cleaning. The machine is called airflow machine. So it can easily remove the stains
Yeah.
on your
See,
teeth.
yeah.
Sabi yan ng ating in-house periodontist, Dr. Janine. Okay. Next question, number 3. Is it true that you should brush every after meal?
Yeah, ideally it should be like that because of the acid formation and the possible buildup ng food. So, mas maganda pag after eating, you have to brush your teeth. Pero syempre, we have our job naman, no? Na busy schedule, that we cannot focus more on our teeth. That's why, as a dentist kami, we recommend at least twice a day. And pinaka-importante, bago ka matulog. Kasi lahat ng kinain mo, it has to be, yung teeth must be clean, diba? And we have to remove all those mga plaque or mga dumikit sa gums, sa teeth, para at least hindi siya mamuo while you're sleeping. So, recommended twice a day. Ideally, every after meal.
Thank you. Number 4. Medyo unique na question. Is it true that a banana peel or strawberry can whiten your teeth? I think the banana peel or yung strawberry, you would scrub it sa teeth and then it will help whiten your teeth. Is it true?
Hindi ko alam eh. Parang ayoko, hindi ko alam. I don't know. No idea. Haven't tried it.
Maybe we can try it and then we can get back to
It's fine. I'm good.
Okay. Number 5. Okay. Maraming matatanda, may kasabihan na the more yellow your teeth are, the healthier they are.
They're stronger.
Or they're stronger. Correct. Is it true?
Is it true? Well, as a dentist, we have to make sure also that we check all the facets, no? We are not just looking at the mere thought of the color of the teeth, something like that. That's why we have to run it with lahat, like x-ray, clinical exam, kung healthy ba talaga yung ngipin na yan. But theoretically, ang daming factors involving that. Pero, pag yellowish kasi yung ngipin sa mga matatanda, it means mas nag-show na yung dentin kasi mas manipis na ang enamel. Pag bata, mas whiter yung teeth because the enamel is quite thicker than pag matanda ka kasi nagdi-diminish yan eh. These are inorganic material, mainly hydroxyapatite crystals. So once you age, your teeth will age as well, and the color of the teeth behind the enamel is yellowish. Yung dentin, medyo yellowish yan siya. So, manipis ang enamel, mas magiging yellowish yung ngipin. If you do whitening on a yellowish teeth sa mga matatanda na manipis yung enamel, mas it will be the enamel health will be affected. It's because of the tawag dito yung chemical ingredients in whitening. That's why we have to gauge also ano ba yung reason bakit siya yellowish. Is it because of like extrinsic lang or gaano kalalim yung kanyang staining or manipis lang talaga yung enamel? So we have to gauge all these things kasi ang daming factors involving when it comes to, the health. Medyo debatable pero at the end of the day, we have to assess it. And we have to assess everything bago ko masabi that mas healthy siya. Kasi ang dami nagki-claim, tapos when I checked
So
it,
for that question, it depends.
it really depends.
It really depends
It
on
really
the
depends.
dentist's assessment.
Yeah, it really depends.
So next question, is it true that wisdom teeth should be removed? Ano ba yung wisdom teeth muna? Yun pala muna, before you answer that, Doc Jonas. Can you answer what is a wisdom tooth?
So basically, a wisdom tooth is a third molar.
Dami ngang synonyms di ba?
Oo.
Wisdom tooth, third molar,
Ayun.
impacted tooth.
And then, hindi naman sila impacted, depends. Parang
Okay.
associated palagi.
Okay.
So, yung third molars na yan, nag-erupt yan siya sa edad na 17 to 21 or 22. Kaya siya tinatawag na wisdom tooth. Okay? Kasi pag tumubay
Kaka-wisdom na.
yes, but by that time, medyo may wisdom ka na. Okay? Kaya medyo late siya Kasi nako-complete yung sets of teeth natin, almost complete by the age of 13. Yun, 13 nako-complete na yung sets hanggang second molars. So pagka 17 to 21, dun sila lumalabas. Ang problem kasi minsan, like the ratio of the
So, Doc Jonas, wisdom teeth, third molars, ito yung sa pinakadulo.
yes, yun yung
We're gonna put x-rays on the video para okay, mas specify.
yun yung most posterior, yung pinakalikod ng ngipin na tumutubo pag nag-edad ka. Usually sa college, siya lumalabas, no? Kaya ang daming yung napapansin, like you have classmates, they have beautiful teeth sa high school, then pagdating ng college, biglang nagkasungki-sungki. These are things na common. Nag-iiba yung facial structure as well. It's because of the third molar eruption. Kasi nag-move forward. So, ito, na-check to ng mga orthodontist So, sa development pa lang nakikita na natin yan. Kaya may tinatawag tayo na early intervention. Like, bata pa lang, na tooth bud pa lang siya, hindi pa siya nag-i-erupt, hindi pa siya fully formed. Nag-start pa lang mag-form yung crown, wala pa yung ugat, tinatanggal na yon. Kasi, pag yun tumubo, doon na nag-iiba yung muka ng bata, ng tao.
Okay. So, that is the wisdom tooth. Is it true? Babalik tayo doon kasi sinabi mo na tatanggalin. Is it true that a wisdom tooth or wisdom teeth should be removed?
Ang dami ko ng topic, diba?
Ang dami mo nang nasabi.
Ang dami ko sasabihin.
Is it true lang?
Wala, 1% pala, ang dami ko bang sasabihin. Hindi siya...
As a surgeon, di ba?
As a surgeon, not 100% because there are cases also that they have, it can cater 32 teeth inside the mouth. So if there's no problem, if it can cater, walang problem, like the ratio of the size of the teeth and the size of the jaw, perfect siya, then why remove it? Don't remove it. If it's not bothersome, don't remove it. But there are a lot of cases, like most of the time, ang laki ng ngipin, ang liit ng jaw. That's why pag tumubo na si third molars, hindi na siya kasya. Okay? So that's the reason why we have to remove it. Because it can cause something like gum problem, infection, occlusion problem. So we have to get rid of the wisdom tooth. So it really depends. Anong perspective ba are we talking about? It can actually change the craniofacial, your face. It can change the face if hindi mo siya, walang early intervention. That's why assessment is really important.
So to answer this question, is it true that wisdom teeth should be removed? It depends.
But most of the time.
Yes.
Most of the time.
Assessment is key. Okay. Parang kung pag may mga nagme-message on Instagram or Facebook, I will also say assessment is key because you can never really check or answer a question online without assessing the case.
If you are in this business of dentistry and you've seen a lot, wala siyang 100% na ganitong gagawin. Wala siyang absolute. That's why we have to assess everything suitable, yung treatment suitable for the patient.
Okay. Last question for the general misconceptions sa dentistry. Is it true that if you get braces, you're only allowed soft food?
Hindi ko siya i-answer directly. Ang sasabihin ko lang, ang the rationale behind is that the bracket, it's actually bonded to the tooth surface, no? So, yung bracket ng braces. Yung braces kasi, it has bracket. Yun yung parang
These are the
metal ones or ceramics na bonded to the tooth.
So, this is the traditional braces. We're not talking about Invisalign, okay?
Yeah.
Just to make it clear, okay?
Yeah. So, ito sila, yung binabond sa ngipin natin. If we eat hard food or sticky, pwede siyang mag-loose yung bond na yon
Of the bracket.
Pag natanggal yung bracket na yon, tatagal yung treatment. It will interrupt the treatment. Kaya tumatagal yung treatment, nasisira yung treatment plan. That's why we are not encouraging our patient to eat hard and soft because this will be
Hard.
the effect.
And the soft nga yung recommended.
Oo, kaya nga hindi nga namin nire-recommend yung hard. For that reason.
Yes. Alam mo ako, personal experience, si Doc Jonas, I had braces when 2013, 2014, anyway, si Doc 2012, 2013 or 2014, I had braces. Si Doc Jonas nag-install ng braces ko. I had sungke here. Yun. I'll try to find photos. But anyway, it was really difficult for me to eat. Mostly really soft food yung kinakain ko during the first phase because it was so tight. Parang it's hard for me to bite. Yun yung naging experience ko. But on the second phase, or maybe after a few months, second phase, we're looking at 4th, 5th month. Si Jonas, he really told me, huwag kang kakain ng hard because it might debond. Yung sinasabi niya kanina. But of course, sometimes, I was still part of the corporate world. We had events. Mapapakain ka. And sometimes, it's hard or sticky. True enough, debond siya. Because I did not listen to my dentist. And what is the cons of that? Tumatagal yung treatment, just like what he said. So, yung answer niya, that's the dentist's answer. Ako naman, a patient's answer, am I allowed to eat soft food or pwede ba hard or sticky? Actually, yes, you can really eat hard or sticky kasi you still can. However, it depends if you want your treatment to be longer. Or, si Jonas kasi nagkabit ng braces so free, I did not pay anything. But it will cost you more. Because if it gets debonded, then you have to pay additional fee para ma-re-cement yun. So, tatagal na yung treatment, hassle for you because hassle siya. Dito siya natanggal. I did not eat in front na hard. Dito siya natanggal, nakaganon yung wire. I'm sure maraming makaka-relate. Nakaganon talaga yung wire, tapos naka-debond yung bracket. Ang sakit. At the time, I was in Naga for an event nga, like what I mentioned. Hindi man ako makapunta sa clinic ni Doc Jonas right away. So it was a little bit painful. I did not have ortho wax during that time. Hassle, painful, bothersome. Tapos, nakakairita siya. During the time I was having my event. So, listen na lang to the dentist because it will save you time, effort, money, bibilis pa yung treatment, and yun, listen to your dentist, they know eh. Yun.
Ang ganda ng explanation mo, no? Pero,
Totoo kasi siya
nakakatawa
personal
to.
experience.
Nakakatawa to kasi sometimes kasi nagiging hindi na siya ganun ka ano ba yung purpose of getting a braces? So yun yung nade-defeat yung purpose sometimes because nagiging iba na yung reason bakit ka nagpapa-braces eh. Hindi na siya yung parang orthodontic treatment.
Yes.
Hindi na siya treatment. That's why ang dami nagdi-DIYs because they thought that braces is like a social status, whatever, or naka-braces ka, ganon. Pero technically, the braces is a treatment.
Yes.
If it's not done properly, if you
And the
will not
patient will not listen to the dentist.
exactly, if you will not listen to your dentist, if the treatment will go longer than expected, then there will be consequences. There will be problems associated with orthodontic treatment. What
ano
are these? Number one is stability of the teeth. Yung ngipin mo, while naka-braces ka, there's a constant movement. So, it means the bone level, pababa po yan. That's why nagre-recede siya. Humihina pa yung ngipin pag hindi siya nakikita ng dentist or hindi siya according to the treatment. Kasi yung treatment na time, importante kasi yon. That's why may time lang tayo.
Grabe, no? Tanong lang natin is, when getting braces, are you allowed to eat hard or sticky? Is it true? So, dami mo nang dami na nating nasabi.
1% pa lang.
1% na naman. Anyway, so the answer to that is just stick to soft food so that the treatment will not take long. Hassle naka-braces.
Yeah.
Super hassle. It's hard for you to brush. Nakaganon ako palagi, oh. Siyempre, meron. Hirap. Anyway.
Tapos pag tumagal na,
yung sinasabi mo na pag tumagal pa, health-wise.
health of the teeth, health of the supporting structure, health of the gums.
So, na-affect din.
Pag matagal.
Yeah.
That's why we have to consider that.
So, stick
It's a
to
treatment.
soft food.
So, food.
Okay. So, we're done for the general topics sa oral health, dentistry. So, we now move on to your specialization, which is restorative and cosmetic dentistry, veneers, bridge, etc. Is it true that getting veneers is necessary?
Well, it's not necessary. Actually, iba pa rin yung natural teeth, no? It is always good to keep your teeth intact. Dapat hindi siya nagagalaw or hindi siya mas maganda. I would love to educate the patient that it is better to have your teeth untouched. Kasi yan yung binigay sa'yo. If it's healthy, don't touch it. If it's healthy, if it's okay naman, wala naman problem, don't put something in there. Yun. So, definitely it's not a necessity to have a veneers. Pero depends. Kasi nag-iiba na yung mundo. Iba na yung need ng tao ngayon.
Okay. So, ito mga next questions, hindi na siya is it true? More on questions regarding restorative and cosmetic dentistry. How long do veneers last?
So, the longevity of the veneers will depend on the material used, the technique, and also yung tawag dito, ang daming factors associated with it. Pero usually in 10 years time, you will get around 75 to 85% success rate. And sa 20 years, mas bumababa siya. Pero it's still there. It really depends on how you take care of your teeth.
Mm-hmm.
Kasi with veneers naman, it's actually on the facial side, sa harapan ng ngipin, and a little bit sa sa gilid, and then hindi naman siya tinatouch yung back portion of the teeth. So, minsan may mga cavities, so you have to really take care of it lang.
Okay. So, based on my personal research, veneers can last for more than a decade. There are veneers who lasted 30 years. And there are articles that can support it. Sa PubMed, mariresearch yan. Google scholarly articles. So, based on research, veneers may last for more than a decade if the patient will take care of it. And here at Apostol, we tell our patients, we educate the patients on how to help these veneers be maintained. Which leads me to the next question. If you have veneers, are there any special oral care you need to do to maintain it?
Well, it should act as if like it's your natural teeth. So you have to floss, brush, go to your dentist every 6 months, and that's it.
That's it.
It's
We
that.
actually give a kit, a post-op kit to our patients after getting a smile makeover. Meron siyang mouthwash, soft toothbrush. Actually, yan ang nire-recommend. Again, sasabihin na naman natin si Dr. Janine, our in-house periodontist. Soft bristles dapat ng toothbrush ang ginagamit. Floss, very important. And visiting your dentist every 6 months. Okay. Again, regarding veneers, another common questions. Are these reversible? Meaning, you want to change it, ginawa mo siya ngayon, next year gusto mo pa-change, next year papa-change ka ulit. Are these reversible?
Reversible, it's not, it's irreversible. Once you have veneers,
It's irreversible.
it is irreversible. Once you have veneers, then you will have it for life. I mean, you have to replace it with a different veneers, new sets of veneers. Because with veneers, we have to scrape a little bit of sound structure so that we can bond the veneers. So definitely, hindi na siya as the same. Pero I had this one patient before. It was recommended by a colleague, no? Kasi during the pandemic, ang daming close na clinic. So, tayo bukas. May isang patient, isang bata, naka-veneer siya, direct veneers. Direct bonding. So,
This is composite.
This is composite. This is composite bonding. It was actually done by a different clinic, pero it's not as aesthetically pleasing. So, ang gusto ng parents, patanggal na. So, sabi ko, I will not make any promises because I don't know the preparation. So, I use a special tool to remove it, like the 12-fluted burr, and then I used like mga finishing burrs to remove it in a way that I will not damage the enamel itself. But true enough, when I remove it, wala naman damage. So, hindi ko masasabi minsan kung ano yung preparation ng isang dentist, kung paano nila ginawa. But technically, kaya nga siya natatanggalan palagi. So, technically, we have to I mean, with the process of veneers, we have to scrape it a little bit for mechanical interlocking, and then also with the retentive preparation, if that's the case, then it's irreversible. Pero for some cases like that, like pinatong lang,
No prep
veneers. No prep veneers at all, wala talagang issue, then it can be done. Pero hindi siya common. Kasi most of the time, may effect talaga siya.
So generally speaking, veneers are irreversible. But if we are talking about no prep veneers, then that's a different story. But it is not common.
It is not common yung no prep veneers kasi based on what others are telling us na no prep, there's still prep because we have to establish the margin in there. Kasi pag hindi, pwede siya mapasukan. Pero iba naman, like purely cosmetic, like they place in the veneer without margins or whatever, pwede naman yun. Pero it's prone to staining.
And we don't do that.
We don't do that kasi it's prone to staining and prone to chipping and
Gum problem.
gum problems. Madali matanggal kasi hindi siya there's no retention in there. Although there's a chemical bonding But we have to put a little bit of like mechanical,
And can veneers be changed? Yes.
Of course, definitely. With the advent of modern dentistry, it's easier to change the veneer. Especially yung mga lasers na yan na associated without breaking the veneers. Pwede yan matanggal tapos replace it. It's easy nowadays.
Okay. Okay. So, dito naman tayo kukuha ng mga questions from our TikTok account. Okay. Pag veneer, okay, so kasi we post cases, different cases on our TikTok account. Nakikita nila when we do veneers, sometimes may sobrang puti, sometimes may yellowish naman or just naturally white, translucent, ganon. So, itong question niya, maybe ito yung maputi yung veneers na pinost natin. Pag veneer ba, ganyan talaga kaputi? Or pwedeng natural lang?
So veneer color is always subjective naman. So if you want, may mga patient kasi na they want white, extremely white, opaque white.
Models
yeah.
natin actually nagre-request yan.
Hindi ko kasi pwedeng ipilit yung gusto ko. Kasi this is what I want, like the whiteness of the teeth. Gusto ko ganito lang, dito yung babagay sa'yo. But at the end of the day, there will be the one who will wear the veneers, hindi naman ako. So they will want that. They would want that. For them, it's beauty.
Yes.
And for some people, ganun dapat. And sa kanila.
Yeah.
Sa kanila ha. So hindi ko pwedeng ipilit yung color na gusto ko. But what I can do is to make the everything should be healthy and functional.
Yes.
These are things that
Non-negotiable.
Yun yung makokontrol ko.
But the shade,
The color of the teeth, hindi ko yun makokontrol. Kasi yun, subjective na yun. So,
we had the patient just 2 days ago, or yesterday ba yun? She had her direct composite veneers replaced. Gusto niya maputi yung upper teeth, and then yung lower teeth, sobrang yellow. And she's okay with that. Ako, I personally talked with the patient. I said, are you okay Kasi pag nagsalita ka, talagang very obvious. Because the upper, super white, yung lower na talagang super yellow din. So really, it's opposite. She said yes. We actually let her sign na it's okay for her. And then I talked to her, I let her sign, you're okay Kasi aesthetically, hindi talaga siya balance. You will really see the difference. But she's okay. And that's her preference. Cannot control what she wants.
Yeah, but what I can control is the shape of the teeth.
And the shape of
Let's say, for example, she likes bunny one. So I can give that bunny,
Yes.
give the bunny teeth, and then it will follow with the curvature of the lower lip. Babagay siya whenever she talks and smiles. So okay siya. I mean, with the bite itself, the preparation,
Yes.
okay, walang...
So we're just talking about the shade naman talaga.
Yeah, pero yun lang yung hindi ko makokontrol. It's the shade of the teeth.
The preference of the patient, what she really wants.
Yes. Yeah, basically that one.
Of course, we recommend. Doc Jonas, you always recommend. But
Of
at the end
course,
of the day, we cannot force the patient on the shade
Yeah.
that she will choose.
Yes. Pero there are cases talaga na I don't really want to use like a certain color, let's say too opaque. I don't use that anymore. Like kahit anong pilit mo sa akin, hindi pa rin. It's white but it's translucent white. Kasi we want to make sure that pag tumagal, it would look natural at the end of the day.
Okay.
It's whiter, yeah, basically, but it's not fake.
Okay.
Dapat ganun.
Yes. Shade lang, dami na naman nating nasasabi. Okay. Ito,
1%.
most common comment or question is bad breath. Natackle natin to one time, episode 1 I think. But do you really get bad breath when you get veneers?
Technically, hindi. Kasi when you... No. Kung nag-start ka ng veneers mo, may bad breath ka pa rin after the veneers. Pero pag wala kang bad breath ng veneers, tapos nagka-veneers ka, hindi ka dapat magkaka-bad breath. Pero may mga associated cases kasi na nagka-veneers tapos associated with bad breath. May mga ganon because of a lot of factors. Yung number one, impingement of the gums. If the yes.
So this is where health function will come and play.
Yes, definitely. So we have to consider all these factors also. Hindi siya associated, bad breath and veneers. Hindi.
Yeah. Yes.
Hindi.
Okay.
Pag may mali lang.
And then, like what we mentioned kanina, that's why we give a post-op kit to our patients so that they can take care of their veneers. Hence, it will not cause bad breath because you took care of your veneers and your teeth at the same time.
Tapos may iba din na cases na hindi nila nagbabrush na masyado. You know why? Because they have pearly white. So,
Maputi na so
no,
you need to brush your teeth.
Pero that's not the reason kasi why you brush your teeth. It's for health. Hindi ibig sabihin na maputi na siya, hindi mo na siya ibabrush. Parang puti ka, hindi ka na ligo. As hindi ka na mukhang madumi. Hindi, it's not about that. Kasi ang daming health yun.
Okay, next. Pag naka-veneers, is it okay to eat hard food? O food na naman tayo. So,
Is it okay to eat hard food? Well, definitely. Basically, it should act like a normal, tooth. But if you want to preserve the beauty of your veneers, I would encourage you not to eat hard because it's ceramic. At the end of the day, it can chip, mababasag yan, pwede siyang dahan-dahan, pwede siyang ma-debond, pwede siyang magkaroon ng problem. So, kinabit mo yan dinikit siya sa ngipin. So, there's a tendency that these things will happen. So, if you want to keep your teeth beautiful, avoid eating like mga matitigas. Pero it can be done.
If you really want to eat hard, use the molar part. Wala namang veneer dyan
Wala namang veneer.
Dito lang, usually here.
Usually, yeah.
If, for
Facial.
example, nuts, matigas yun. Don't eat directly here sa front teeth wherein you have veneers. You can use your molars to chew the nuts. Okay, a few more questions. Last 3. Are veneers and jacket or crown different?
Yeah, it's totally different. When we talk about veneers, it's basically a more conservative approach. With jacket crown kasi it's like lahat ng surfaces ng ngipin
Will be touched.
Yeah, will be touched, binabawasan lahat to insert the jacket the jacket crown.
So jacket is more invasive compared to a veneer.
100%.
And of course, it depends on the case of the tooth. If the tooth needs a veneer or if it needs a crown.
Yeah, definitely.
Okay. We actually have a vlog about it. We did that 2 years ago. And so very detailed yung veneers versus jacket. Lalagay rin natin yung link here. Okay, last 2 questions. I have mild sungki, Doc. Can I still get veneers? Because I don't want to have braces anymore. I want to go straight with veneers. Aesthetics lang yung concern ni viewer or ni commenter.
Well, kung hindi mo na kaya yung mild sungki mo na yan without any intervention, so it really depends on what you want. But basically, it can be done. I mean, we've had a lot of cases involving mild malalignment na we treated it with veneers.
We had a vlog posted a few weeks ago si Miss Christine Burmas, Viva Max artist. She had the malalignment, diba? But she cannot do braces. She cannot do Invisalign. Kasi siya, artista siya and marami siyang shoot. Dami niyang mga movies. So, bawal din daw, sabi ng management. She really wanted to get better smile because she's artista siya. So we went straight to veneers. But Doc Jonas, diba, we talked to her, telling her pros and cons, mas maganda braces, etc., etc. But of course, we need to meet halfway. Pero ang ganda-ganda na ng smile niya.
Yeah.
Yeah.
And less invasive.
And lesson,
Yung isang sungki lang kasi it's very very sungki. So I removed a little bit more on that one side, but
Yeah.
sa lahat naman hindi.
full vlog is posted on our YouTube channel. So the answer is yes. Kung may
100%.
sungke, yun. But Dr. Jonas will talk to you regarding other options.
Yeah, would I recommend it right away? No, 100%. Because it's technique sensitive. You have to have a team of very very skilled laboratory technicians also to work with you.
Yes.
Kasi let's say for example, this is what I want, and then ito lang yung skill level. So hindi kayo mag-meet halfway, ang kawawa yung patient. So we have to be,
Yes.
technical about it.
Okay. Last question na. A very quick answer. Since we do teeth preparation when we do veneers, will your teeth become sensitive moving forward? Or will it be sensitive forever?
Well, there are cases like that, like associated with sensitivity and veneers now. May ganun talagang factor. Pero at first few months or weeks, for some a day lang may sensitivity. Pero after some time nawawala naman yung sensitivity as long as there's no problem with the cementation process, or there are cases talaga ng ngipin na super sensitive, or there's problem with the bite, or there's problem na hindi siya nakikita na may micro cracks pala, tapos pag during the preparation medyo nagkaroon ng exposure doon, tapos nagkaroon ng something. That's why we do a lot of techniques.
So the answer is?
The answer is depends.
It depends.
Hindi siya 100%. Wala namang absolute
Yes.
kasi iba-iba yung cases talaga. Hindi we cannot say na 100% magkakaroon ng sensitivity or
Yes.
nawawala ka agad yung
Yes,
sensitivity.
and
So daming factors pa din.
we're not promoting anything, pero really helpful daw, useful. Sabi ng previous patients namin, Sensodyne. It can help.
Yeah, a toothpaste that could stop those sensitivity will always be a good option, no?
So the answer is, it's not all the time that
Not
there
all
is
the time.
sensitivity. It depends, case-to-case basis. And if there will be sensitivity, we take action, like immediate dental sealing,
Yeah,
mga ganon,
ang daming
etc., etc. Nagiging technical na tayo.
Pero
Okay.
hindi naman siya 100% sure na like may mga minimally invasive pero meron sensitivity. Merong medyo invasive pero walang sensitivity.
Case-to-case
Case-to-case
basis.
talaga yan.
So, thank you, Dr. Jonas, for answering our questions. If you do have other questions, we are always available on our social media accounts. You can message us, comment, and then we will answer. Hopefully, we can answer your comments, all of it. But yun nga, if you have mas seryosong question, assessment is key for us to be able to give you a treatment plan. And thank you for joining our episode today.
Thank you,
I
guys.
hope you learn a lot, and please tune in for our next episodes to come. Thank you, Doc Jonas.
Thank you.
Thank you, everyone.